Advanced Podiatry and Neuropathy Center. Fill us in on what you're doing.
So I am a foot and ankle surgeon, podiatric surgeon. What that means is I treat basically any injury problem that you have from just below the knee all the way to the toes. I've been in practice now for 13 years, but I just opened my own practice here back in December of 22. So we're very new, trying to do my own thing and kind of find my own niche, and started my own practice for a multitude of reasons. It's something I wanted to do ever since I was in medical school. So it was the right time. We got started and we're full steam ahead right now. Primarily in foot and ankle trauma, which is any injury you get to the foot or ankle. I've been doing sports medicine with some of the local professional teams, collegiate athletes, and high schoolers for the past 13 years. And then I do reconstructive surgery, which is like bunions, hammer toes, total ankle replacement, lots of different types of surgical procedures to realign or replace joints. My first job opportunity was here in Cape Coral. That was in 2010. I came here at the fall of 2010 and was in a podiatry clinic for a year. And then I joined an orthopedic surgery group. I was with them for almost 10 years. And that's where I got exposed to the professional athletes. We worked with the Everblades, with the Twins, their minor league teams. And it was a really neat experience. It taught me a lot. That's where you kind of grow as a surgeon and learn a little bit about patient management and selecting the right patients for procedures. It was time for me to move on. And I really had that desire to just kind of do my own thing, manage my own company. And the time was right. So I jumped on it and we opened this practice. It's been a fantastic experience. A lot of business things I had to learn. I thought I knew and I really didn't, but we're getting there. One of the biggest misconceptions about podiatrists is that we just treat nails, corns, calluses, all that kind of stuff. A lot of people say, oh, I need foot surgery. I'm going to go see an orthopedic surgeon, right? And so, an orthopedic surgeon and a podiatrist in terms of their surgical skills these days are fairly equal. 20 years ago, that might have been a different story, but we do a whole lot more foot and ankle surgery training than an orthopedic surgeon does. Their residency is 5 years long. Ours is 3 years long, but they only get about 6 months worth of foot and ankle training during that time. We do 3 years to focus specifically on foot and ankle. We also learn general medicine. We go through the same rotations that the MD and DO students or residents rotate through. So we get a very broad medical training in addition to very focused foot and ankle surgery training. There shouldn't be any hesitation on the part of your listeners or anyone for that matter when it comes to having foot surgery by a podiatrist, because we are extremely well trained. We've been through quite a bit more surgical training for the foot and ankle than any other specialist. You're in good hands when you come to our clinics.
One thing you wish our listeners knew about Advanced Podiatry and Neuropathy Center, what would that be?
Don't be scared of the treatment. Like, I have a lot of people who come in to see me and they have a very, very bad problem. And the reason it's so bad is because they waited. They didn't come in and get treatment when it would have been easy. It makes the recovery a lot harder. It makes the stuff that we have to do to fix them a lot more difficult and a lot more time consuming. And most of the time, what people tell me is that they were just scared of what I was going to tell them. They didn't want to have surgery. They didn't want to get a shot. They didn't want to have the treatment that they thought they were going to need. Most of the time they were wrong, and what I probably would have recommended had they come in sooner. Things are always a lot easier to treat when we treat it early. So prophylactic care is the best, trying to prevent problems before they start. And it might not be something you want to go through, but we hold your hand through that process. We help you through it every way possible, try to make it as comfortable and easy for you as we can. I'm a doctor who listens, who's going to take into consideration all those things. I'm not just going to rush in the room, tell you what needs to be done and rush out. I'm going to sit with you. I'm going to explain everything to you. I'm going to make you comfortable, make sure that the process is as easy as possible for every single one of my patients.